Hi everyone, welcome to the Growth Paramedic channel. This is the Pharmacology class, and today we are going to cover the medication fentanyl, which is used for pain management in the pre-hospital setting. Very similar in terms of usage to morphine, but before we begin, we'll do a quick disclaimer. So this channel is for educational purposes only and is not intended as medical advice. Whilst I always strive for 100% accuracy, errors may occur and medications and protocols do change over time. So please do not solely rely on the information provided on this channel, but as additional reinforcement to your learning either at paramedic school or on road as a practicing clinician. So now that we got that out of the way, I'm just going to go through the main kind of structure that we'll cover fentanyl with, and that's with 3 sections, and all of them will be time-stamped. So they're going to be the definition of fentanyl, and I might include reasons why you may use either fentanyl or morphine, and what are the benefits of each one in terms of when would you use morphine and when would you use fentanyl. So we'll go with the definition, and then we'll go to the pharmacodynamics. So how does the drug work in the body? So it's a very almost exact same structure that we have done in the past. Again, if you want anything else added onto it, like the pharmacodynamics, the pharmacokinetics, please feel free to comment in the videos and I'll make an effort to include them in later videos. So these are the 3 that we'll cover for this video. So definition, pharmacodynamics, and precautions. And all of it will be time-stamped. So this is the introduction part. If you wish to skip through to key areas that you want to revise on without watching the whole video, then you can simply go to the timestamps that will be provided to you. So now that we got that out of the way, let's head straight into the definition of fentanyl. So let's head down here. So definition. So fentanyl is a narcotic analgesic, very similar to morphine in terms of pain management. So let's keep it similar. So narcotic analgesic. And if you're wondering what narcotic analgesic is, if you haven't watched the first video in the pharmacology class that covers morphine, narcotic refers to a psychoactive compound with sleep-inducing and euphoric properties, which is associated with opiates and opioids. So I'll write that down for you. So narcotic, psychoactive compound with sleep inducing and euphoric properties, and that is associated with opioids or opiates. And as we have mentioned, fentanyl is an opioid agonist. Well, now we've mentioned it. I'll cover through that in the pharmacodynamics. But yeah, so it's associated with opiates and opioids. Okay, perfect. Now with the analgesic, that's a very simple one. It just simply refers to acting to relieve pain. Relieve pain. Perfect. It's a synthetic narcotic, so it's an opioid agonist, analgesic, and it acts on the central nervous system. So fentanyl acts on the central nervous system, the CNS. And it does this by binding to opioid receptors. And I'm only just briefly mentioning it here, and I'll go through in the pharmacodynamics, but it binds to opioid receptors, and this binding causes an analgesic, so pain relief, and sedation effects. So in the pre-hospital setting, it has two primary usages, and that is for sedation and for pain management. Normally, if you're going to sedate a patient, we'll kind of lean more to midazolam or droperidol, but in other cases, it can be used for that if you need it. So when considering whether to give fentanyl or morphine, that's kind of one that's often placed in front of paramedics in the pre-hospital setting, whether to give one opioid agonist or the other. There are a few factors to put in mind, and so I'll write them down. So fentanyl versus morphine, and both of them are used for pain management, so that's what we know already. Both used for pain management, and I'll only go through the advantages of fentanyl and some of the disadvantages. I won't go through fentanyl then morphine, because again, we're just covering fentanyl in this class. So for pain management, fentanyl does have some advantages. So fentanyl, let's write that down here. For pain management, it is, in a sense, when it comes to the pre-hospital analgesic effect, it has a faster onset time. So compared to morphine, it's faster and it's rampant. So faster onset time. It has a shorter duration. So it doesn't last as long, and its effects are shorter than that of morphine if you were to administer morphine instead of fentanyl. And it releases less histamine. And we know that when histamine is released, that causes vasodilation. So if you were to administer morphine in large dosages, that can cause a drop in blood pressure. So in terms of pain relief, if you were to administer fentanyl over morphine, there's a less greater effect in terms of the blood pressure dropping. And so those are some of the advantages with fentanyl. In the pre-hospital setting though, fentanyl fentanyl is normally only administered via the nose, so the nasal cannula. So that is take it as you will, that I would call that a disadvantage. So let's go with advantage. And let's go with disadvantage. So with its main administration method being intranasal, for obvious reasons, if there's facial trauma involved that involves the nasal cavity or the nose, fentanyl administration would not be a viable option. So immediately there are certain situations where you can't use fentanyl because you can't use it for the main route that it goes through. And some ambulance services like New South Wales, the only mode of administration or method of administration is via the intranasal the nasal cavity. So if you don't have a viable nose, in a sense, like if the nose is fractured or destroyed in whatever way, you of course can't give fentanyl. So it's administered intranasally. Just intranasally, and it's done by intranasal mucosa atomization device, and it basically converts fentanyl into a fine mist that then goes through the nose. So it's like a spray. So intranasally administered. Which then means that it not viable in certain situations. And obviously if that's the case, then you already know that you're just going to use morphine. But again, that limited access or administration routes to a patient means that of course there'll be some times you just can't give it. So facial trauma. And the other disadvantage for fentanyl is that it's shorter acting. So it's both an advantage and disadvantage when it comes to this short duration. So it has a shorter duration. And in terms of pain management, if you have a patient for a long time, or if you have a long transfer to a hospital, fentanyl, which should not be your main choice in terms of managing that patient's pain, if you know that you're with the patient for a long time, because again, it doesn't stay in, the effects don't stay as long as morphines, but it does happen quicker. So morphine should be used for long-term pain management, while fentanyl is primarily should be considered for that quick pain relief in instances where there's major pain on site, or when you go to a patient and they're screaming of pain, and you just want to quickly calm them down and quickly get that pain down, then fentanyl should be considered. So shorter duration means not ideal for long-term pain management. And that really comes down to your own clinical experience and your own knowledge on pharmacology and your own critical decision making. So really, I'm saying that, but if you want to, you can continuously give them fentanyl. I don't recommend that. If you're going to give them an opioid analgesic, then go for one medication that is more suited for it. So not ideal for long-term pain management. Okay, perfect. So now that we've got the definition out of the way, let's head to the pharmacodynamics. That won't be as long as the other videos when it comes to this section, because we've already covered quite a large bit of it in the morphine class that we did a while back. So the pharmacodynamics. Okay. So we know, as in the morphine class, that fentanyl is an opioid agonist. When it's administered to patients, it will bind to opioid receptors. So when it's administered, it will bind to opioid receptors. And these receptors receptors are the mu, delta, and kappa. Delta and kappa receptors. So those three. And you're really going to memorize these. These are the mu, delta, and kappa receptors. And to give you an understanding, or to help you memorize what happens again, as we know, fentanyl is an opioid agonist. So if it's an opioid, it will then most obviously bind to receptors that recept or receive opioids. So that's how you know that mu, delta, and kappa are the receptors for it. So but please do keep these three receptors in the back of your head, because for both morphine and fentanyl, these are the receptors that it will bind to. For fentanyl, though, it has an especially receptive binding to mu opioid receptors. So of the three opioid receptors, fentanyl binds especially well to mu opioid receptors. And for clarification, we'll explain what mu receptors do. So mu receptors, let's do an arrow. They are found in the brainstem, and its effects include the following. So there's three main effects I want you to be aware of when the mu receptors are activated. So it has an analgesic effect, so pain relief. It alters sensation of pain. It also causes respiratory depression. And I'll go through that in the precautions part, because that's also one of the precautions that I've noted that you should be aware of if you're going to administer fentanyl. And in larger dosages, it can cause sedation. So that's the main thing with the pharmacodynamics. You just mainly need to know that it's an opioid agonist. So agonists, when they bind to a receptor, it produces a biological response. So it increases whatever the receptor is doing. And in this case, mu receptors cause analgesic effects. It also causes respiratory depression. So when fentanyl binds to these receptors, these pain relief effects are heightened, are increased. And that's the main kind of underlying principle with these pharmacodynamics of opioid narcotics or narcotic analgesics, is that it's all about pain relief. So let's head off to the precautions now. And there's a few things I want you to be mindful of when you're administering fentanyl. And the main three that I'll talk about today is the geriatric patients, so older patients. So the geriatrics. And for geriatrics, if you don't know what that means, it just simply means the older person. Geriatric patients. And why do we talk about geriatric patients in the precaution part? Usually geriatric patients have poorer hepatic and renal health, because they usually have comorbidities, chronic illnesses that affect these kind of conditions, and also just with general aging process, a lot of things that happen in the body are slowed in the process of aging, affects basically all aspects of the human body. And so normally or usually geriatric patients have poorer hepatic and renal health compared to younger patients. And for this reason, they have altered metabolism and excretion. And that's important to note when you're administering medication, because if they have altered metabolism, the way they absorb and remove medications is also altered. So when you administer fentanyl with in these patients or to these patients, the medication can have a prolonged effect. So longer than you intend the effect to have, and also increased potential for adverse effects, such as like respiratory depression. And we'll actually we'll go through that. We'll cover something else before then. As we know, with morphine, administration of morphine can cause vasodilation, so a drop in blood pressure if administered in a large amount. But with fentanyl can also cause hypertension. So hypertension is a precaution to be aware of. And in comparison to like morphine, one thing to note is that fentanyl is reported in a few studies to have less histamine release than morphine. So really, in comparison to the alternate narcotic analgesic, it's less vasoactive. So the lesser vasodilator. And I know there are a few other medications that we can use for pain relief, such as ibuprofen, paracetamol, and methoxyfluoride. But as paramedics or EMTs, I think as well, morphine and fentanyl are your main choices. And I'm not including ketamine in this options list, because ketamine is an ICP drug, so it's a serious drug, and if you're going to administer that, chances are that you have a person of a much higher clinical level administering that. I know New South Wales Ambulance, you need to be an intensive care paramedic to administer that. So this is information that's mainly relevant to just the standard qualified paramedic. Okay, perfect. So, yep, so vasodilation is a risk or precaution to be aware of if you administer it. So if the patient is already borderline having low blood pressure, just be mindful that you can worsen that. And finally, but not lastly, there are a few other precautions to mention, but these are the ones that I want you to be really aware of, is that fentanyl can cause respiratory depression in large dosages. So, respiratory depression. And the reason for this is that, as I've covered in the morphine class, the opioid receptors are located in the central nervous system, and the agonist effects that fentanyl has can cause inhibition of the ventrolateral medulla in the central nervous system. Perfect. And why is that important, and why did I mention that? Well, that results in depressed respiratory generation. So be mindful with those patients who already are presenting with low respiratory rates. So if you're looking at their chest and they're not doing more than 12 breaths per minute, or even 10, the normal range or healthy range we kind of set as the standard in our vital signs survey is 12 to 20 breaths. So if they're doing less than 12 breaths, just be mindful that if you give them morphine or fentanyl or any of those opioid agonists, that you will cause depressed respiratory generation. And in large amounts, you can cause sedation, and you can also cause the patient to stop breathing. And then you would have to manually breathe for them. So again, use your own critical thinking and observations of the patient, and monitor the patient if you do administer this medication to see whether or not you are causing respiratory depression. So that's kind of obvious. If you realize that what you're doing is making the patient's condition worse, you have to find solutions to stop that, because again, your main goal in the pre-hospital setting is to do no harm and to make the patients and to provide positive patient outcomes. So that's it for the pharmacology class for fentanyl. I hope you guys learned something today, or have your knowledge reinforced about fentanyl, and I'll see you next time. Thanks.